I actually have a question and a comment. My comment is I was one of those moms that was in Andrea's office this week, absolutely devastated by this news. I hope that the board members have lost as much sleep as I have over this. I'm actually due the end of April, and obviously missing this March 31st deadline. But had I had my first in Windsor, I would have had the urge to push, come around Kingsville. So imagine that drive from Kingsville to Windsor, feeling that urge to push. My labor was 2 hours and 44 minutes. I cannot imagine how short my next one's going to be. My question is, obviously this has been a concern for years. The OB unit has just always been on the chopping block as long as I can remember. But I want to know what's been done in the last few years to promote the OB unit, to get that 50% and that 85% that are delivering in Windsor, to get them back here. I want to know what's being done.
Rebecca? What have you done?
Well, actually, we've done a lot over the past year and a half. I know that there have been community newsletters out all about promoting the OB service. We've had our own patients in the news, as well as my nursing staff. Other things that we've done to try and promote the service is we've held a couple baby showers, community, over the past year. One in Kingsville and one in Harrow, okay, trying to pull from that market and getting those women this way.
That increased our numbers.
That has helped. This is Lauren at the back, one of the OB nurses, and Lauren, you are correct. The numbers have gone up, okay, from last year at this time to this year at this time, by about 33%. Now, it takes a while to make that happen, right? It takes time, okay, pregnancy is 9 months. We started those baby showers just as our new doctor had come on board, and she had to develop a practice as well, and we were working towards that. So I just don't want people in here to think that I don't care about the OB service, because I think my staff at the back know that I do. It has been my whole career. And I have a strong passion for labor and delivery. That's all I have ever worked. So it's very emotional, okay? It's been a very, very tough decision for our community and for this hospital.
Thank you.
I just want to say I'm another one of those women who have been in Andrea's office recently. I need to meet you over there on the side of the road on the way to Windsor, because I'm a month off of our March 31st deadline. I'm due at the end of April, and my first delivery was very quick, and I'm very terrified. I've been tearing up, thinking about delivering on the side of the road realistically. And I think what you guys have done to try and promote our program here is wonderful, but I haven't heard of any of that. I've heard of none of those things promoting our Leamington Hospital here. And I know of many people who don't even think you can get an epidural here. There's lots of bad stories about things that happen here from the previous years of those previous OBs. And those are the stories that have stuck around. And those are what people hear about. And I think much more needs to be done to bring up that 85 and 50% number, because the education isn't out there. I don't know, maybe we've used the wrong avenues, but I haven't heard any of those positive stories, or positive like the baby showers. I don't know, maybe we need to use new avenues. I haven't seen it on Facebook, and I'm in a number of mamas groups. I brought this meeting to a number of them, and a lot of them even wanted to be here, but we had such short notice for this meeting that I had half a dozen people who wanted to come and who couldn't schedule it because it was short notice. And so I think the women, the education hasn't been given to us to tell us that, you know what, Leamington is an awesome place to deliver. I'm a newborn photographer, and I hear from so many moms who deliver here who love their care here, who are so happy with their care here. And I just think we need to try harder. I know budget, I understand budget. Budget sucks. That's how it is. But I think we need to try harder before we give up on it.
I just want to ask my question again to the Lynns. I need to hear from you. I need you to talk to the women in this room about their fears. Like, I don't want to keep doing that conversation. I want you, like, now, to address these women about their these are not just fears. They're real risks of having their babies on the road. And I think the gentleman back here said $700,000 for one mom, one baby. Like, that's a big deal. And I also want you to talk about this option of a pilot project we have. Like, we have a solution, so I need to hear from you. I need you to talk.
Thank you. I'm Gary Switzer. I'm the CEO of the Erie St. Clair Lynn, and I'm here just for this reason. This decision isn't going to be made in a vacuum. I've been the CEO of the Lynn for going on 10 years now, and I know many of your board members, and I tell you, they're a committed bunch. They're a very committed bunch because they put their community first, and they'll tell you that right to your face. And so, and I deal with boards, I deal with 88 different boards in Erie St. Clair, and I got to tell you, you should be proud of the team that you have here. With respect to the birthing program, I'm aware of it. I'm not sure where it is in the process to be approved by the ministry, but I will follow up with you because that is talking about going forward. Just as birthing, so I tell you the story about my mom, okay? My mom's 90, lovely little lady, and she still thinks women should have 5 days in the hospital when they give birth. And why? I need a break. And I talk to mom and say, things have changed, things have evolved. And just as your birthing center that you're talking about with midwives is another evolution, it has to continue to move forward. Okay? And I understand the fears, and I hear, I see your concerns, and, the decision that our board needs to make once we hear formally from the hospital, takes all those things into consideration. Quality is the first goalpost you look for. That's the punchline here. You got to ensure that quality is maintained, and you got to look at the evidence, and the evidence is there. And John, you're going to do your best to drive up the population, and I hope you do. But I just gave a presentation yesterday that showed the population declining in the age bucket 25 to 39 in all of Windsor-Essex. I know, births across the entire 3 counties are going down. And people like me are getting older with more gray hair. And so evidence is one thing, and looking at that, and funding formulas, but understanding the concerns of the mothers, that has to be understood and addressed. And I, working with Windsor Regional and Chatham-Kent Health Alliance to ensure access and ensure that services are available, and working hard here to ensure that pre and post is available. Those are good steps. But keep in mind, our board weighs all of this information before they make a decision. And this is considered a LIN decision because any change in service in a hospital or any service provider has to be approved by the LIN. Now, 10 years ago, anything could happen. The good thing is the LIN is down here, but even better, we can't hide, and that's why we're here today. I recognize the Lower Mennonites represent around 70% of your births. As for notice to them, I'll pass it over to Terry.
So this is the third community engagement that we have. We already had one with the faith group, 14 different ministers, pastors, about different faith, and we will be meeting with them going forward. So we have the responsibility, working together with all the providers in the Erie St. Clair Lynn, to make these adjustments with regards to birthing.
So Lynn's coming to those meetings? You guys coming to those meetings? We need to hear from those groups too. We need to hear from the women in that group.
I have a question in regards to the pre and post care that you're offering to women that are pregnant in this area. Do you know what that will entail? Terry?
So, no, not at this time.
Okay, so here's my question. Right. Mm-hmm. Yeah, so my question is, any woman that does come here, let's say they don't feel their baby move. So they come to the emergency room because they haven't felt their baby kick. They've done their kick counts as their midwife or their obstetrician has suggested them. They come to the hospital and you find this baby is in severe fetal distress. Do we ship them to Windsor? Probably not.
I feel like it wasn't heard. No, the birth in Windsor and in Chatham, maybe not so much Chatham because I haven't been there, I don't know, but Windsor, it's not a place I want to go. I don't want to birth my baby there. I don't want to have my babies there. It's awful. It's very medical. They push everything on you. Ella was born unnecessarily by C-section. I was not distressed. She was not distressed. It was just taking too much time for them because they are too busy. They're too busy. They don't have time for you. I was there for one night with Ella with my C-section. I was kicked out. They needed the room. They had no time for me. I had no nurse in there with me while I was in labor for 40 hours in labor by myself. Nobody was there helping me because they were too busy. Every single room was full. As soon as she was born, I was practically kicked out. I just needed more time. Even after 40 hours, I needed more time. And they didn't have it for me there. In Windsor, I was so supported. It was so supportive there. Leamington. Thank you, Leamington. Another 40-hour labor. But I had a successful VBAC because I had support. So much support. I had nurses in there, 2 or 3 nurses, almost all the time, and support and support and support. And I delivered her vaginally, successfully, and it was amazing. And I would come back to Leamington again. I will not go back to Windsor.
Mr. Spitzer, I'm Lillian Masternardi. I spoke with you today. You told me that your wife delivered, you were 1 hour away, and you had no problem with that. Good for you. You didn't have a facility near you. We have one. And you told me, hey, birthing centers are going to come and whatever. So you're going to spend more money to build a birthing center somewhere near here or whatever when we have the most qualified, the best people right here at Leamington Hospital. The building's already here. The room's already here. It was refurbished, all brand new last year. Why would you give that up? For $700,000? That's a kick in the bucket. That's nothing.
Hi, I would just like to say I live in Leamington too. I had a baby here 2 months ago actually. She's here. She's sleeping. But anyway, I would be with you. I'm one of those women who, I had a very progressive delivery. When I came into the hospital, I was 9 centimeters dilated. I would have been one of those women on the side of the road. Sorry, it's emotional. But anyway, you know, I heard a number that 30 women, I don't know if it's true, but 30 women a month give birth in this hospital. Let's not diminish the value of those 30 women and their babies. I know it's only 30, but like a lot of women in my age group, we were hearing those bad things about the obstetricians. That's why we didn't want to come here. But now it's turned around, and I had my baby delivered by Jyoti, one of the midwives in our area, and it was fabulous. It was a great experience, and I hope to come back here. But if we don't have an obstetrician or obstetrics department, then I would be one of those women on the side of the road, and that scares the heck out of me. So, you know, like I said, let's not diminish the value of the women who do want to come here, and let's get the word out there about how wonderful this obstetrics department is, because they truly are. And I understand, you know, a woman spoke earlier and said, you know, we're doing things to promote the hospital. That's great, but I live a block away from here, and I didn't hear anything either. So maybe there's more we need to do. There's more we need to get the word out there, because, like I said, I'm local, and I haven't heard any of that. So maybe there's more work to be done, and let's not give up on it yet. You know, maybe there's more we can do.
I actually have a question about, you said you had talked to the EMS. I had a spontaneous pneumothorax, that's when your lung collapses spontaneously, 4 years ago. My parents left at maybe 10 minutes after the ambulance had left my house, and they beat me to the hospital. I had to ride in that ambulance by myself, terrified. So what are you going to say to me when I have to ride in the ambulance by myself, giving birth to my first child in 6 weeks? all the way up to Windsor because my doctor didn't see the point. And me being in Leamington, having a doctor in Leamington, when I'm not going to have any of the rest of my kids here, and I also want to know, not only did you say you're going to provide post and prenatal care, but what woman wants to come here for post and prenatal care and then deal with a completely different doctor in Windsor while they're giving birth?
So there are limits about what we can do pre and post, but it's really about having people who reside in these communities plural, reduce their travel time. That's one of the feedbacks that we got. So if there's something that can be done here locally to help them, we will look forward to doing that for them, for the community going forward. With regards to your situation with EMS, I will talk to Bruce about that directly, and I'll have him contact you. I'm sorry.
No problem, thank you. I guess, we're talking about EMS, and I'm listening to all these stories from you, expectant mothers and so forth. And in my previous life, which was EMS for a number of years, that's where I know you from, Gary, you're absolutely right. But anyway, I can't tell you the number of babies that I helped deliver or delivered in cars, in beds, in bathrooms, in toilets, in pail. Like, I've gotten them from all over. Lily, you're back there, you can attest to many we brought in from those, right? And I guess where I'm coming from with this is that how can we expect these mothers that are expecting, I can't, I've never delivered babies, so I can't tell you, what the process is, but I guess where I'm coming from is the fact that how are you going to know when that baby is delivered? And I'm sympathizing with these individuals that are saying that, I don't want to have my baby on the side of the road. A lot of you don't know when this is going to happen. It's a spontaneous procedure for a lot of you. And I think the closer to the hospital, the better. Because I don't know what would have happened in a number of cases had we had to rush to London or to Windsor or whatever with the newborn baby in the back of an ambulance. So, we got to keep it here.
Hi, my name is Diane, and I'm one of the new midwives in the area. I'm a lifelong resident of Windsor, Essex, and I came back to this region to serve the women and families of this region who are in greatest need. So I was very much looking forward to being part of the wonderful maternity care team that Leamington particularly had to offer. Leamington is considered a level 1 hospital, Mr. Switzer, you mentioned quality of care being utmost and front and foremost. If you look at the benchmark data that's provided by Bourne, Leamington Hospital is fairly high up on the benchmark. So given more time and a little more support financially, obviously, I think that Leamington could be one of those hospitals that promotes the normal childbirthing process and not so much having those medical interventions when needed, but definitely Leamington is one of those hospitals that promotes the natural childbirth process. And in doing so, you can actually be looked to by other communities and other hospitals in the province and say, okay, what are they doing to get such high benchmark ratings? So I really do think that the women in this community really deserve this hospital to stay here and to deserve this OB unit to stay here because of the quality of care that's being promoted here. I can say also as a new midwife in this community, I'm also, we have offices both in Windsor and in Kingsville, and a lot of Windsor women are choosing to birth out this way because of the care that's provided here and because of the quality of care that's been benchmarked and evidence is showing. So I would really encourage you to look at those numbers as well, as I'm sure you have, and I appreciate you coming here tonight. Thank you.
I got 2 points I want to bring up. We never did get a response to Lauren's good point, and I'd like to hear that from you, Mr. Shields. Second thing is to the board here. If I heard it right, the board's going to make a recommendation, then it's up to Lynn to approve. Is that correct? I'd like to know from our board, what would it take from this community to change your mind? Is it going to take a commitment of cash? If it is 700-some thousand, we can probably come up with that. Would that change your mind? Would it take a petition? Would it take you know, a march down the street, whatever. I'd like to hear from a board member on that one, John or Dave. And also if I could get a follow-up on Lauren's question.
What were to happen if a woman was to show up because she hasn't felt her baby moving or whatever? We would typically bring them upstairs, do a non-stress test where we would strap the woman to the machine and check out the baby, get a reading on paper of what the baby's doing. If this baby happened to be in severe fetal distress, what would we do if there's no obstetrics?
We haven't gone through the details with regards to what pre and post. We haven't gone through the details of what pre and post would look here. But in a situation like that, it would be an emergency call to EMS and transfer to Windsor. No one's going to argue that we are all on the same side with regards to this issue. Okay?
I think I'm correct too in stating, is the EMS not required to bring any patient to the closest hospital? Yeah.
Most appropriate hospital.
So if a woman was to say she's not feeling her baby kick, would they not bring her to Leamington Hospital?
No. Protocols are developed for a big stroke. We would bypass for stroke. Someone has a stroke in the field, okay? EMS picks them up, we bypass, they go straight to Windsor Regional Hospital. It'd be the same thing as that.
So this is mainly all about money. It's all about money. And I was actually talking to some EMS this week, and they're like, that's okay, we'll just put more trucks on the road, and hey, we're high seniority, we'll get steady day jobs. So where are you saving the money? If you don't have an OB here, you're going to have more trucks on the road because they're taking an hour to get, it's a 2-hour trip, either way to Chatham or to Windsor. And I know RPNs have been on a price freeze here for years. There's been talk about RNs being on the price freeze. What are the managers doing?
Thank you. Very good question. I took over here 2 years ago. I took over the operations here 2 years ago. And in those 2 years, I've reduced management staff by 25%. We have saved over $500,000 in salaries. I took that money and I put it right back in the front line. Those are facts. It's not anything. We look at everything. I'm an accountant. I look at everything. I agree with you. The passion that you're showing, I thank you. It's the same passion that, whose question am I supposed to ask? Okay. Wait. Okay.
Okay, my name is John Servini, for those who don't know me. I've been on the board, I think, 12 years now. So, I guess I can tell the story too. They give me the microphone, I guess I'll talk for a minute. So, all 3 of my children were born here. My last one, she's 13 years old today. When I left my house, it took me 45 minutes to get back into bed. So, I live in Leamington. I brought my wife, had my third, and I was home in bed in 45 minutes. So, I can feel and I understand the stories that I hear. Because my wife didn't want to go. She says, oh, no. So, John's right. I believe people don't always know, or well, they can't always tell exactly how fast it can happen. So, that's my story. So, the board does have, or I do have, a personal story. And surprisingly, I'm getting emotional talking here too, so please be patient with me. So the next thing I want to tell you is not a single board member wanted to close this program. We absolutely did. We absolutely did. But nobody wanted to close the program. Okay? Okay. I'll get to that. So, like Terry said, we have a fiduciary duty to this hospital and to the minister. We have to balance the budget. So when we brought in the Hay Group was really here to help us decide which services should stay open at this hospital and for this community. So if you really look at the numbers, whether we like it or not, the population is getting older. And we have to take care of the community at large. So we made the best decisions possible for the community that we have here. So whether or not the community likes all the decisions, we feel for you, because like I said, not a single one of us wanted to close it. But one way or another, we have to keep the books balanced, we have to keep the hospital open, we have to keep the emergency department open, and that is our goal.